Okay, well, let's get started on this. There may be some people joining us in a few minutes. That's fine. Thank you all for attending this webinar on when we get to introduce our new addition to the NARCH program, the R34 Planning Grant Award. And we'd like to know who's participating today to help us gauge the effectiveness of our outreach and make sure we're not just speaking amongst ourselves and to other federal agencies. So if you don't mind, please use the Zoom participant list to edit your name and add your affiliations, your school, your tribe, your organization, whatever it is that makes sense to you. And you know, we are feds, so we can definitely decipher abbreviations and acronyms, what we like to call the alphabet soup approach to names. That's fine with us. So to do that, you open up the participant window, you find your name, and you click on the 3 dots. After that, you choose rename, and then you just edit. And with luck, we'll see a lot more applicants here than federal staff. My name, by the way, is Michelle McGurl. I'm the acting director of the Division for Research Capacity here at NIGMS. And we are the division that manages the NARCH program. And with that, I am going to turn it over to Kyungsuk Gartrell, who is going to tell you all about the R34 Planning Grant NOFO. Kyungsuk?
Thank you, Michelle. Please note that this meeting is being recorded. Slides and webinar recording will be available on the NARCH website. This is panel who will participate at Q&A session. Michelle, Christian, me, and Christy. Christy, who knows the financial and grants management side of the program. We will be asking you to type your questions into the chat window. You do not need to wait until this webinar is done. You can put them in at any time. Michelle will moderate the Q&A session. I want to thank all staff who have helped me. So with that, we'll get going. So just a little bit about NARCH program itself. NARCH stands for Native American Research Centers for Health. The purpose of the NARCH program is to support federally recognized American Indian, Alaska Native tribes and organizations to build their capacity for doing health-related research. NARCH program began in 2001 in collaboration with Indian Health Service. Program management was moved from Indian Health Service to NIGMS in fiscal year 2017. NARCH is a trans-NIH program. Each participating NIH institutes, centers, offices can support projects from different grant applications in their mission areas. So far, there are 28 NARCH active awards to 19 tribal entities in 14 states. Tribes that have applied for and historically received NARCH funding comprise a small fraction of the 574 federally recognized tribes. In addition, while 75% of first-time applicants received funding, those who were not funded were unlikely to apply again. So, to enhance the program's efficacy, NIGMS completed a comprehensive NARCH program evaluation, culminating in a formal tribal consultation in September 2021. Tribal consultations report and feedback are available at NIGMS evaluations. The feedback from former tribal consultation is summarized here. Tribal leaders want to ensure both research projects and research infrastructure or capacity buildings are primarily conducted by tribal nations and communities rather than by academic partner institutions. Tribal leaders want to remove barriers to application by reducing complexity of submission requirements, particularly for tribal nations or organizations that do not already hold NIH grants. Tribal leaders want to ensure great opportunities for new applicants to learn from existing grantees through mentorship or collaboration on proposals. Tribal leaders want to ensure that reviewers understand the importance of culture and language as research elements for examining health disparities, resilience, and dealing with trauma in Indian country. NIGMS response includes a number of new funding opportunities. This one is a NARCH planning grant, which uses the R34 mechanism. Planning grants addresses a specific recommendation received through the consultation to increase participation of eligible tribal entities in the NARCH SO6 program. To provide support for potential applicants to conduct preparatory work needed to develop comparative NARCH SO6 applications. To explore tribal research interest, assess the available research and administrative workforce, build relationships and partnerships. To formulate overall goals for a future NARCH SO6 application. So, the grant recipient is expected to submit a NARCH SO6 application within 1 year of the end date of the NARCH Planning Grant Award. The first due date this year is July 8th. After that, it will be annually on July 8th. Okay, the big question from many of you watching, I assume that, is my organization or am I eligible to apply for the NARCH planning grants? So here is some guidance for that. The applicant organization must meet one of the following criteria: a federally recognized tribe, or a tribal college or university, a tribal health program, or a tribal organization or government, or a consortium of 2 or more tribal entities is allowed as long as all meet eligibility requirements. Additionally, eligibility is limited to tribal entities who have never had a NARCH SO6 award and at the time of submission are not supported by an active NARCH R34 Planning Grant award, including those in no-cost extension. This only applies to future submissions. Each eligible tribal entity may submit only one application per due date. Here are principal investigator eligibility. Principal investigator must have a primary appointment with the applicant organization. We recognize that some tribal entities have special employment arrangements, such as interorganizational personnel agreements among federally recognized AI, AN tribes are allowed. Multi-principal investigator applications are allowed. All multi-PIs must be from eligible tribal entities. Non-contact PI must also have a primary appointment at an eligible tribal entity. Partners who are not PIs are allowed. Can be SO6 awardees, other tribal entities, or non-tribal entities. That means non-tribal partners are allowed. Someone from those institutions cannot be principal investigators. About the budget. So you can see there is maximum $225,000 per year direct costs for up to 2 years. For applications that include partner organizations that are not tribal entities, the direct cost for subcontracts to these organizations combined must be 25% or less of the application's overall direct cost budget. A NARCH R34 Planning Grant is not renewable. If an R34 application is unsuccessful at the first time, resubmission is allowed. If an SO6 is submitted but not funded, you could apply for a new R34. It is critical that applicants follow the required application elements. The submitting organization must complete in advance the required registrations, which are covered in Section 3, Eligibility Information. The application must include a letter of vision and commitment. A letter must be from a senior organizational official, such as a tribal council leader or tribal college or university president, that describes the organization's vision and commitment to develop their workforce and infrastructure for health-related research. Applications missing this attachment will not be accepted for review. Letters of support should be included. A data management and sharing plan is not required for this notice of funding opportunity. Page limits as described in the SF 424 application guide. Specific aims is limited to 1 page. And a research strategy can be up to 12 pages. Research strategy. It should describe the organization's needs for a NARCH Planning Grant award. It should explain how the proposed activities will lead to a future NARCH SO6 application. It should also lay the groundwork for a future NARCH SO6 application. For example, define research questions, assess research workforce and infrastructure needs for SO6 components. SO6 components will be discussed in next slide. Also, please identify any collaborators, consultants, or advisors who will contribute to the R34 application and explain their rules. You could also propose activities to identify potential SO6 collaborators, consultants, or advisors. The research strategy should address the following elements. If any community engagement activities that will be employed in the planning process, describe activities to involve communities in planning and reflect their needs and values. If you need assess the needs for new or strengthened administrative capabilities, please identify what is available and what is needed to support future research. If you need assess the workforce and infrastructure needs, please identify what is available and what is needed and develop strategies to build capacity, including for required administrative core. Please outline strategies for choose among the allowed SO6 components, such as research projects, pilot projects, career enhancement projects, or research infrastructure enhancement projects. If research projects or pilot projects will be a likely component in the future NARCH SO6, please explain activities to define research questions and provide a plan for how to manage the project. This slide is a continuum of the research strategy elements. Data management and sharing plan will be required for any SO6 that supports research. So the R34 Planning Grant might want to describe plans to develop a data management and sharing plan. If the R34 involves more than one tribal entity, non-tribal partners, external collaborators, consultants, or advisors, describe their roles and contributions to the planning activities. If other partners, external collaborators, consultants, and advisors are anticipated for the future SO6 application, please provide a plan to identify individuals with the suitable expertise, along with a plan to engage them in the development of the SO6 application. If the SO6 is likely to involve human subject research, describe plans to identify or develop needed infrastructure like an institutional review board. So, how does the review work here? Well, in the first step, your application comes to NIGMS. Both the program officers at Division for Research Capacity Building and Center for Scientific Review officers do their jobs, and they review your application. They are looking for applications to make sure they are eligible, compliant, and responsive. If it is not, they get withdrawn. Therefore, please read and follow the Notice of Funding Opportunity instructions. Make sure all principal investigators are eligible. Make sure the submitting organizations have not had prior SO6 award by checking the NARCH dashboard and archived NARCH SO6 awards. It is a good idea to apply a few days prior to the deadline so that you can actually see what your application is going to look like to the people who will review your application. And then it gives you time to fix it and resubmit if you need to. Some of the common issues that cause people to be administratively withdrawn, cause that issue are missing attachments, such as the letter of vision and commitment, or you have ineligible partners, or you include pictures and figures in a bio sketch. All of those things will be checked. Your application, if it has any of those issues, will not be allowed to go to review. Let me explain to you about BioSketch. BioSketch is a short name of biographical sketch that documents an individual's qualifications and experience for a specific role in a project. NIH requires submission of a biosketch for each proposed senior or key personnel and other significant contributors on a grant application. So please think carefully about what the parts are and how to make your application survive that to get to the next step, which is the scientific review. Here, the applications are divided among special emphasis panels, and the numbers just depend on the number of applications. Assigned reviewers provide preliminary scores from 1 to 9 before the meeting starts. The lower score is the better. At the meeting, these reviewers describe strengths and weaknesses and provide written critiques according to the review criteria. All reviewers then discuss the application, and all panel members vote on the application and provide their individual impact scores. Those scores are averaged by the number of reviewers and multiplied by 10 to give the final overall impact score. In other name, it's called priority score, which is available within a few days of the review meeting. Summary statements are available about 30 days later. A summary statement outlines whether or not your application was scored, how the scoring decision were reached, and exactly what your specific reviewers had to say. This slide shows you how to interpret the overall impact score. High impact score can be ranged from 1 to 3. Indicates that planning activities are most likely to lead to the submission of a successful SO6. Medium impact score can be ranged from 4 to 6. Indicates that planning activities may lead to submission of a successful SO6, but minor weaknesses decrease the impact. Low impact score can be ranged from 7 to 9. That indicates that planning activities may lead to the submission of a successful SO6, but major weaknesses decrease the impact. Will be unlikely to find a score ranged from 7 to 9. For this case, after reviewer comments are addressed, and you may resubmit your application. So here is some advice from our colleagues. Please read the entire notice of funding opportunity carefully and pay attention to section 5 review criteria, because the critique templates contain the exact same question as they are asking in the notice of funding opportunity. Also, feel free to use the public health service assignment form to indicate expertise needed, but do not suggest reviewer names here, because it could introduce non-objective reviewers. But it is okay to provide names of those who should not review your application. If you have any questions before submission and after the summary statement is released, please contact your program officer. If you have any question after submission and before the review meeting, please contact your scientific review officer. This means that after review meeting, before the summary statement is released, there is no need to contact anyone. We want to remind you that next Wednesday, January 17th, from 2:30 to 4 p.m. Eastern Time, there is a free application webinar for the NARCH SO6. Please join us, and we hope to see many of you. And with that, I am going to take a break and let Michelle answering questions that you have put into the chat. Thank you all so much for paying attention.
Well, thanks so much, Kyung-Suk, for giving us the guidance on what's expected in the R34 application and things to watch out for. We really appreciate your expertise on that. So there are a couple of questions already in the chat. I noticed that we have both a Q&A button and a chat button. And if you can put your questions that you're about to ask into the chat button, I'd appreciate it. It's hard to follow too at once, but I'll do my best on that, okay? So we do have two questions, and I'm gonna ask Christy Leek to take the first question. It says, are UIOs eligible? And this comes from Kimberly Copeland, AIHFS, and Kimberly, you have caught me. I said I know all the acronyms. I don't know what this one means. So Christy, if you know, you can answer the question. If not, we'll ask Kimberly to unmute and explain a little bit more. We'll wait. Okay. Well, while we are waiting to answer that, actually Christy's unable to unmute. So I will attempt to answer the next question while we're waiting. And this one was also in the Q&A section. It comes from the University of Wyoming asking, are non-tribal academic institutions eligible to apply if they have a supporting letter from a tribal resolution? And no, they would not be eligible to apply because the University of Wyoming or another non-TCU, a non-tribal college or university, could not apply because they are not considered, they don't meet the tribal entity definition. They can be partner organizations, they can be, hopefully help if they're asked by a tribe. But the goal of the NARCH program is really to fund research by tribes, for tribes, and fund the tribes themselves to do the research that they want to conduct. So academic institutions, universities, and colleges that are not formally tribal, tribal colleges or universities are not eligible. So I think Christy's able to speak now. Why don't you answer the question about the UIO, Urban Indian Organization?
So I think the terminology UIO is new to me as well, but as long as a UIO meets the criteria outlined in the NOFO for eligible organizations, you would be eligible to apply. But based on how your organization is set up, you would need to verify that you are eligible in order to apply.
And that's something you can follow up offline with us for, Kimberly, if you'd like, and we can work with you to answer that very specific question. So Greg, thanks for that. And Greg Bohatch is asking, what are some of the ways that non-tribal colleges and universities have successfully participated in NARCH programs in the past, or other ways in the future? Well, that is a really good question. Since Kyungsuk is rather new to NIGMS, I'll do my best to answer this question. We have seen a lot of very productive interactions and partnerships between tribal organizations, tribal entities, and academic institutions. And so that is absolutely fine. You need an understanding of how the NIH works, I think, to even get through the gauntlet of submission requirements. And that's something that universities like yours, Greg, at the University of Idaho, and other institutions really do get, other academic institutions. Tribal colleges and universities also have expertise in that as well. So if you want to partner and help with management, with organizing, with research structure, maybe helping with some, formal guidance about thinking about human subjects research that is always difficult, helping through IRBs. Those are things that tribes that haven't done a lot of research might need some help with. And so I think those are ways that you can be productive in partnership. We do have some rules about how much money can go to the non-tribal entities for SO6 grants. So you'd want to make sure that all of that fits with everyone's needs. So we would just want to be sure that the tribes are really controlling what the research topics are and how they're happening. There's no requirement that a research project in an SO6 grant be led by someone who is, a Native American or Alaska Native, right? That is not needed, but it always helps. I think it's always a great idea, right? So those are some things I can think of. For those of you who have had NARCH grants, is there anyone out there who wants to unmute and answer that? I know we have some people who've done really great work together. Okay, I don't see any hands raising, so we'll go on. Are there other questions about the R34 grant?
Michelle,
Yeah, Christian?
if the NARCH program has a career development program, or building infrastructure, they can also help them, building that infrastructure, and also mentoring the investigators, AI investigators at the tribal nation, they can help that way also. There are other ways, they can be involved, with the NARCH SO6 program, mentoring, building infrastructure, etc. Thank you.
Yeah. A lot of NARCH programs help build the capacity for future, health research leaders and people who are, fluent in science and technology and health related occupations. So they work they propose projects that address needs at the high school level, for example, or at community college or primarily undergraduate institutions level, any place where there's a need to build the capacity and to have greater representation of American Indians who are managing their own affairs is really what we want to see here. So those are all options that we've seen successful NARCH SO6 programs do. And of course, partners who are experienced in grant writing, partners who are experienced in navigating the many NIH systems can really be helpful in this. And, those are true commitments. As long as everyone is on the same page about making sure that, tribal culture and values are honored throughout the process, those kinds of partnerships are just great, and we encourage them. So I will just give everyone one more second to ask questions. And I'm not seeing any. I don't see anybody looking like they're typing furiously. So I just want to then thank you all for attending this webinar. Feel free to contact Kyung Suk. Her email was given, and you can find us on the website. If you do have additional questions, we'll be happy to answer them. And as you start working on your R34 applications, lots of times you end up saying, I didn't think about asking that. I have some questions. Feel free to reach out at that point. We're always here to try to help you understand NIH speak and help you interpret it, help you put in the best application you possibly can, and help you understand the rules of how to do that successfully. So thanks so much. And we hope to see applications come in for this program. Bye-bye now.